This morning, New York State has announced new health and safety regulations for nursing homes. Statewide, more than 5,000 nursing home residents have died after becoming infected with coronavirus. CBS News' John Diaz joins us live from the Isabella Center in Washington Heights with more. John.
Yeah, good morning, Mary, to you. And COVID-19 related deaths here at the Isabella Center in Washington Heights are about 100 here this morning. No doubt many families of loved ones who live here and across the entire state of New York breathing a sigh of relief about these new rules and regulations, while others, though, they're saying that it may be too late.
This virus uses nursing homes. They are ground zero.
The governor announcing strict additional regulations on Sunday to better protect the more than 100,000 New Yorkers living in nursing homes. Statewide, the workers must be tested twice weekly for COVID-19. And in what is seen by some as a reversal of a March 25th order, hospitals must not discharge COVID-19 positive patients to nursing homes, either holding them or transferring them to a COVID-19 only facility.
We're just not going to send a person who is positive to a nursing home after a hospital visit, period. If there's any issue, the resident must be referred to the Department of Health, which will find alternative care.
Previously, nursing homes were told they had to take the patients to avoid discriminating against them. But the governor denies that the new regulation is a complete reversal. He says nursing homes always had the right to refer COVID-positive patients elsewhere if they couldn't care for them. Some critics say this should have been in place sooner.
The reality is it's too late. It's too late for my family. It's too late for too many families.
Xiomara Garcia King of Castle Hill in the Bronx shared with us these photos of her 62-year-old father, who was transferred from a hospital to the Isabella Center in Washington Heights, where he died.
The purpose of sending him there was to protect him, and instead they infected him. They neglected him.
Her father died alone, and right before he did, put a desperate plea in writing.
My father asked for help. He wrote that note to us. He wrote several notes to us asking for help.
The nursing home has not discussed the case, citing patient confidentiality. The governor says nursing homes get their operating license yanked if they cannot provide appropriate level of care, personal protective equipment for all staff, and proper isolation of patients discovered to be COVID-19 positive.
They will lose their license. Well, that's harsh. No. Harsh is having a nursing home resident who doesn't get the appropriate care. That's what's harsh.
Now, by Friday, all nursing homes across the entire state of New York must submit a plan to the Department of Health about how they will accomplish these new guidelines. Also on Friday, New York State on pause is slated to expire. We are told later on today, Governor Andrew Cuomo will outline what local governments must do in order to reopen. We are live this morning in Washington Heights. John Diaz, CBS 2 News.